I am Dr. Shubhranshu. I am a consultant and head Department of Pulmonary Medicine in Narayana Hospital at Jaipur. The trends in COPD, as many of us know, that it's definitely increasing all over the world. If you talk about this part of the world, definitely it's increasing into both the rural population as well as the urban population. And one of the most alarming trend that we see is that it is coming into the early ages of the life. Like earlier we used to see patients of 40 or 50 plus coming with COPD, but nowadays we are seeing patient coming of 30 or 35 or at the late by 40 also coming with COPD. So this is an alarming thing which we should think about. And probably the factor which I think is causing this COPD is definitely one is smoking, and another the deadly pollution. This pollution, this automobile pollution, that the industrial pollution which we are seeing day in day out, this is causing this early increase in the COPD in early ages. So I think this should be sorted out. As far as the challenges in diagnosing and treatment of COPD is concerned, as I already told that the cause of COPD, as very well known, is smoking and the pollutants. I think this should be strongly sorted out, because as smoking is a preventable part which we can prevent and the development of the COPD. Simultaneously, the second challenge is other than the treatment, the education to the patient and the relatives about the disease, about the causative factors, which most of the people are not doing. I think is a strong challenge, because we know that there is no particular treatment to the COPD. Only thing is that it can be prevented, and quitting smoking and prevention from exposure to the pollutants is the only way of escaping the progression of the disease. We have a GOLD guidelines, that is a global initiative for obstructive lung disease, which releases every year or 2 years the newer modality, newer guidelines for the diagnostic, for the prevention of the COPD. And that is the GOLD always mentions the definition of the COPD is a common, preventable and treatable disease. The preventable word is the one which should click to everyone into the health sector, because this is the only disease which we can prevent, but still it is progressing. So a disease which can be prevented is a progressing, I think we should be aware about it. I am attached with Narayana Multi-Specialty Hospital. It's a group of Narayana Health, and the USP to our group is like we provide health to most of the people in low cost. Simultaneously, I have been working with this institution since almost more than 8 years or so. Again, the important thing which I am looking is the prevention and the patient education, because when we see patients in the severe form of the disease, where at that point of time we cannot treat the patient, we cannot do anything about it, we feel helpless. So at that point in time we think of we would have prevented that disease. So the patient education, as such education of the patient, simultaneously the education of the society, is the one thing which I am taking forward. That is the one USP for me. And like I have seen many times whenever we prescribe any medicines to the patients, most of the doctors, they always write down the medicines, their doses and everything, but we never mention about the causative factors, we never mention about the health lifestyle modifications, like as far as COPD and other smoking related disorders. I always write on my top of my prescription that one has to quit the smoking or anything related to tobacco. So this has to be always be emphasized upon whenever we treat any patients of obstructive lung disease.